Hi everyone, welcome back to my channel. Today I will discuss why exercise and extensive rehab is required following a ACL surgery. Most of the time we have seen a very good ACL surgery was done, but the patient was not that convinced or not that stick to the program of the rehab, and the results is not good. So what was expected could not be achieved. So let's understand why a good rehab, protocol based rehab, and long rehab is required for a good recovery of ACL reconstructions. To understand these things, we need to know how the ACL is reconstructed. To reconstruct the ACL, we took tissue graft from our body. Basically, that's a part of the tendon around the knee, we took it out. When the tissue is taken out from the body, that means it becomes dead. Now, when it reinserted and fixed within the bone across the joint to give the stability, we do expect that the body system will transform this tendon into a viable ligament. To happen these things or transformations, new blood vessels to be grown inside this graft tissue. Basically, this graft tissue acts like a scaffold where new blood vessels can grow and it can replace the tendon tissue into a ligament tissue. Immediately after the surgery, up to 2 months, this tissue has the maximum strength. After that, because it's a dead tissue, slowly it starts getting its strength loosening. So from 2nd to 6th month up to this time, this tissue, this graft is the most vulnerable tissue at this moment. If we do not do proper exercise and do not build our knee joint muscles, we do not build a proprioception, then what will happen? There is always sliding movement between the two bones, upper and lower bones of the knee joint, and the muscles around the knee joint. The role is to minimize that movement. Following ACL surgery with rehab, if we cannot establish this kind of stability enough, then while doing our day-to-day activity, there will be a lot of sliding movement, and the graft between the lower and upper bone, they will have stretch movement, and it will slowly lengthen. So ultimately, when the times will come, the harvested graft tendon will convert into ligament, but they will have a elongated ligament, and it will not serve the purpose of stability for what we have done the ACL reconstruction surgery. That's why after the surgery, if someone not sticking to the strict protocol of rehab, they will not get the excellent results of the ACL surgery. So my advice to all the people, especially not only the athletes, but especially to the non-athletic population, because athletes, they have already their tendency of doing physical work and exercise, they can do, but for a non-athletic person, sticking to this exercise protocol is very difficult. So always, who are going under this ACL reconstruction surgery, strictly follow this rehab protocol, stick to your surgeon and the physiotherapist team who have done the procedure, so that they know the outcome and they can follow through your recovery. Thank you.